Good afternoon and welcome. We are so excited to welcome you here today and provide case studies for effective communications and partnership strategies for reaching socially, politically, and economically vulnerable communities. My name is Alyx Colgan, and I am a senior consultant at Guidehouse. Prior to joining Guidehouse, I worked in education as a teacher and then later for an education nonprofit where I managed our school and principal partnerships. I work on Guidehouse's FEMA account team, where I support clients in strategic communications, project and program management, and training design and delivery. I am passionate about community-driven disaster risk reduction, and I believe that the best response and mitigation plans are co-created. I want to introduce you to my colleague, Ashanta Douglas, who will share a case study later on in this presentation.
Hello, everyone. My name is Ashanta Douglas, and I'm a manager at Guidehouse. Alyx and I have similar backgrounds in education and nonprofit management, going back to teaching together at the same high school in Miami. I currently work for Guidehouse's state and local government team, supporting clients in change management, project management, and strategic communications. I am currently supporting a large county in the Midwest with the Emergency Rental Assistance Program by providing project management and communication support to ensure equitable grant delivery. Later in the presentation, I'll be sharing a case study to illustrate the importance of community partnerships and communication efforts.
Vulnerability in disaster response and recovery typically refers to someone's predisposition to experience adverse effects from disasters and other hazards. Today, we will be specifically talking about people who have a diminished capacity to cope with, anticipate, and recover from the impact of a disaster. And I want to challenge you today to see communication as a key ingredient in decreasing a person or community's vulnerability. We know that under-resourced communities and members of racial and ethnic minority groups are more likely to be impacted by disasters and more likely to suffer disproportionately when a disaster occurs. And there are many reasons for this, including language barriers, perception of risk, distrust of government, and a lack of preparation and sufficient protection, largely stemming from income inequality. We also know that this disproportionate impact is rooted in insufficient communication and access to relevant information for people to make informed decisions about how to protect themselves against risk. At the center of increasing equity is increasing access. It is our job, all of our jobs, to ensure all people within our communities have access to information they need to make informed decisions. Acknowledging that resources are not equitably distributed across our society, we need to put in the time to learn and understand how to communicate with vulnerable populations and act from the belief that if we are not communicating to those who need to hear it most, we are not doing our jobs. And communication doesn't solve everything. Access to resources and funding will continue to be a challenge for vulnerable communities. However, working within our own influence means using communications as a way to increase access and ultimately to impact equity. So risk perception refers to our interpretation about risk, and specifically the judgment we make about those risks and the likelihood of negative occurrences such as injury, illness, disease, and death. Risk perception is an important concept because it tells us how people feel about risks and hazards around them, and it helps define which of those they will care about and how they will confront those risks. Risk perception is not easy to measure. It is rarely rational since the human brain uses a mixture of learned information with emotional appraisals when weighing risks. This tells us that understanding human behavior is key to creating effective communications because we need to speak to both the logical part of our brains as well as the emotional part of our brains. There are many factors that impact risk perception, and I want to draw your attention to three in particular. Those are trust, control, and awareness. We will use these factors to guide an effective communication strategy to reach vulnerable communities. The first factor is trust. When people trust the officials providing information about a particular risk or the process used to assess risk, they tend to be less afraid than when they don't trust the officials or the process. And I'll prove that this is true. Think about the current relationship between the media and the American public. Are there media outlets you trust to deliver your news? What about the ones that you don't trust? If the ones you don't trust told you to care about something, would you? Evidence says probably not. We seek out people and organizations that we believe care about us and will deliver us unbiased information. Within vulnerable communities, distrust is heightened due to social, political, and economic challenges that have eroded trust through unfair and unjust policies, and frankly, from a lack of inclusion in important decisions centered around their well-being. The second factor is control. Perceived control over outcomes is very important. And this factor can be explained when you think about people like me who are very afraid of flying in an airplane, but don't have the same fear of driving or riding in a car, despite the fact that automobile accidents kill disproportionately more people per year. We feel more in control with things that are familiar and where we believe we have the knowledge and skill to impact the outcomes. Finally, we have awareness. Media coverage of high-profile disasters raises awareness of particular risks more than others. Likewise, events that hit close to home, like a friend or family member who is diagnosed with cancer or loses their home in a flood, heightens risk perception for particular risks. And while these are not the only factors that impact risk perception, we will talk today about how we can impact trust, control, and awareness through effective and equitable communications. Let's talk first about trust. Building trust can take years. Therefore, this is one of the hardest factors for organizations and agencies to effectively do. First, a huge piece of building trust is in understanding the history and culture of the community you're trying to reach and using this knowledge to develop more effective communications. This can be done through research, and it can be effectively achieved through surveys and focus groups. A great example of the importance of understanding historical and cultural context occurred during the H1N1 outbreak. Healthcare workers in Washington state attempted to lead a vaccination campaign with a local Somali community, failing to realize that a handful of the H1N1 vaccine contained pork gelatin as a preservative. The addition of pork, generally seen to be dirty in the Muslim religion, led to a failure in the vaccination campaign. It is unlikely that research, a survey, or a focus group would have helped these healthcare workers. What they needed were local community members to share this knowledge with them and help them understand how to effectively communicate the risk of H1N1 and the benefit of the vaccination. This is where effective partnerships come in. Agencies can build relationships with grassroots organizations that are already trusted by the community and use them to help communicate their messages. A good question to ask is, who does this community trust? The answer to that could be religious leaders, local politicians, organizations, community leaders, and organizers. When you've pinpointed these people and organizations, you can build a partnership with them to help you understand the group you want to communicate to, and either have them communicate your message for you or use that partnership to help you determine any historical or cultural barriers that could impact your message. The next really important way to impact risk perception is to increase people's feelings of control. To highlight the importance of this, I want you to think about how many times you've avoided something because you felt you didn't have the means or the skill to tackle it. I asked this to a friend recently, and they told me that for years they wanted to buy stocks, but it always seemed too overwhelming, something they didn't think they had the knowledge, skill, or patience to figure out. Recently, they started investing in the stock market through an app because it was easy to set up and easy to get started. So how do we increase control and make people feel empowered that preparedness is within their reach? We can do this in two ways. First, by understanding their context, best achieved through sitting down and co-creating solutions and plans. And second, we can simplify what it looks like to prepare or respond to a disaster by giving options for mitigation or recovery that are easy to understand and whose process we make clear. Be prepared to roll up your sleeves and understand what communities need. This is also a really effective way to build trust. How might you co-create solutions and co-plan activities with communities? The impact of co-creation and co-planning is that communities and individuals will increase their feelings of control and empowerment through increased agency and choice. The second is to simplify preparedness. Give people options for preparedness and recovery that are within their abilities. And be explicit about the importance of these actions. Is one thing more important than the other? The key is to take something that might sound scary and turn it into something that is manageable and digestible. To put this into perspective, I want to highlight a study from Listos, a grassroots organization in California trying to increase preparedness in vulnerable communities. They note that of those most vulnerable that they surveyed, 68% had recently seen or heard something related to disaster preparedness. Only 36% of them felt they were prepared. And this is important. The majority think preparing is important, but also believe it's expensive and scary. So how can we help communicate to communities and allow them to see disaster preparedness and risk mitigation as something they can do? How can we communicate actions that are easy and those that don't require significant resources? All of the things we talked about also drive awareness. There are 2 additional actions we can take. First, ensure communications are in the correct language and written at the correct level. Understand that translating is not the only step, as evidenced by the earlier example of the H1N1 vaccine distribution. Communications must be culturally relevant. Second, understand the news sources the community turns to and trusts. Ethnic media is a term you might have heard. It signifies media that is community-driven and represents the culture, ethnicity, and language of the intended audience. Seeking out local radio and print media sources that are community-specific will help you communicate to your targeted audience. We have talked a lot about the importance of the message and the importance of who delivers that message. This last point is about the channels the message goes through. Know who your community turns to for their news. As we highlight the next few case studies, I want you paying attention to these definitions that we provided from Harvard Health in thinking through how these apply to the case studies ahead.
Great, thank you, Alyx. So with that, and using risk perception as our lens, we will look at 3 case studies to see how organizations and agencies have thought about trust, control, and awareness to increase preparedness and response. So in December 2020, the federal government allocated $25 billion to aid households that were financially impacted by COVID-19 by providing financial assistance for unpaid rent and utility bills. Funding was provided directly to states, U.S. territories, local governments, and tribes to distribute rental support to eligible residents. Over the last 3 months, I have been supporting a large county in the Midwest that received approximately $70 million through federal funding and needed to quickly develop policies and procedures to distribute money to residents in need. Within just 1 month, the county was able to establish a call center, application portal, large-scale marketing campaign, and received more than 16,000 applications from tenants and landlords. Much of the county's success has been due to their decision to mobilize community partners. These partnerships were developed over the course of several years through proactive outreach to a number of housing stability and housing counseling organizations within the county. The county was able to launch their program in such a short period of time because they built strong relationships prior to the development of this program. Their partnerships included 19 individual nonprofit organizations, one of which is supporting the Emergency Rental Assistance Program by providing additional staff to their existing call center. And that call center will be able to answer questions from potential applicants and provide more than 150 languages to ensure equitable access and support for applicants. So after the call center receives a call from an applicant, they then refer applicants to one of the 18 partners who are providing application assistance and other housing stability services. During the application window, the center made just over 1,600 referrals for application support. So those are individuals that may not have had support before, but because of the partnerships that the county was able to develop, they'll be able to complete their application with the help of a nonprofit organization. With the help of our partners, we were able to reach more than 90,000 residents through a joint social media campaign, billboards, print advertisements, and other mediums. The county wanted to work with diverse organizations to ensure the network we were tapping into properly represented the diversity of the county's population. The partnerships included organizations aimed at supporting Arab American families, the Latinx community, and other region-specific organizations to ensure we're serving all parts of the county that are significantly impacted by COVID-19. So what are some of the lessons that we learned? We know that with experiences with discrimination, exclusion from social program opportunities, and harmful government actions rooted in racism, they've created individual and community level distrust in many vulnerable communities. Our team recognized that the best way to distribute our message about the COVID-19 economic opportunities were through trusted community partners, recognizing that part of communication is about who delivers the message. Many of the community partners were grassroots organizations who knew families directly impacted by COVID-19 and could ensure they received vital information, effectively expanding our reach and impact through community voices. I want to talk about the application of this case study. The work we did in partnership building to spread our message can be used across disasters and across communities. Early in the planning process, we recognized the limits of our potential reach, and we utilized nonprofits to allow us to expand our footprint, effectively using partnerships as a force multiplier to reach more people than advertising alone. Our community partners also helped people actually apply for grant funding. This is a new situation for everyone, but giving people tools and resources to help them apply for funding was an effective way to increase access because our partners worked alongside the applicants. And finally, we drove awareness through many languages our message was translated into to help ensure language access for all residents across the county. The result of our communication effort allowed for over 16,000 applications from all over the county with demographic data indicating that our message reached individuals with the greatest need for assistance. Turn it back over to Alyx.
Our second case study will focus on some of the recent California wildfires. Although wildfires have always been a disaster risk, California wildfires have been increasing in both intensity and frequency over the past several years. Undocumented immigrants are a vulnerable community that have been commonly overlooked during disaster risk communication efforts for several reasons. First, language has created a communication barrier, requiring additional effort from community and government officials to effectively communicate risk. Second, building trust with undocumented immigrant communities means establishing and maintaining partnerships with local community leaders, which takes deliberate time and effort long before a disaster strikes to ensure officials can successfully communicate risk during an emergency. Finally, government officials often fail to consider how their immigration status has led communities to be wary of accessing services from government organizations, which could be shared with the Department of Homeland Security and ultimately lead to deportation. During the 2018 Camp Fire, the 2017 Sonoma Complex fires, and the 2017 Thomas Fire, none of the Ventura, Butte, and Sonoma counties initially sent evacuation notices in languages other than English. Emergency information online later included an option for Google Translate in Spanish, but the Ventura County Offices of Emergency Services failed to assign staff for live translation during the disaster event. Immigration and Customs Enforcement often states that they will not check immigration statuses of evacuees. However, many individuals cited their fear of going to shelters because of the uniformed National Guard officers stationed outside. Despite these challenges, there was an example of a local radio station providing important information and resources to the community. During the North Bay fires in 2017, KBBF, a bilingual radio station in Santa Rosa, stepped up to translate evacuation information to the community when that information was not being translated by the local government. The president of the board of directors for the radio station told KQED in an interview, "We're a radio station, but we have information and they don't trust anyone else to give them that information." This really demonstrates the power of trusted community voices. The station invited local politicians to spread their messages, set up a donation center that shared life-saving resources when undocumented members of their community were too afraid to seek other resources, and even shared about local families who were providing meals to people in need. I want to highlight that this radio station stepped in because local government and organizations failed to communicate to communities in a language they could understand. They filled a need because they had to, and because government agencies continued to pour resources into things like shelters, failing to truly understand the fear undocumented individuals felt around deportation. Building trust is the key to effectively communicate your messages. To do this, you must identify who you want to communicate with, understand the historical factors that have eroded trust, and collaborate with those in the community who are already providing aid and relief. One of the greatest barriers to effective communications during the California fires were policies that created a perception of risk where seeking aid or shelter would potentially be riskier than staying in place. In a time where we want to increase people's sense of control, historic policies and practices were working against that. Beyond translating life-saving information to Spanish, this radio station was a staple in many undocumented immigrant households and a familiar source of information. They organized assistance for families and individuals in the community and ensured they had access to the information they needed, and were successful because the community trusted their long-standing relationship. Partnering with radio stations like this would be key for government agencies and non-governmental organizations in the future, given their access to the community and the trust they've already established. And our third case study. One of the Miami communities significantly affected by COVID-19 was the Haitian American community. At one point, about 6 months into the pandemic, Haitian Americans made up 5% of all COVID-19 deaths in Miami. And this is notable for two reasons. First, Haitian Americans make up about 4% of the county's population. And second, demographics of those who have died seldom include ethnic data. This only started being captured by medical examiners after the city realized the challenge they were facing. And even then, the information wasn't always captured, indicating that the count is probably inaccurate and potentially even more concerning. While many factors have led to the disproportionate impact of COVID-19 on communities of color all across the United States, for residents in Little Haiti, additional social and cultural factors impacted the spread of the virus in the community. One of those factors, noted by a doctor who leads a public health task force for the Haitian American Coalition of South Florida, is an embarrassment and a fear that friends and family would not want to socialize with them. In a culture that values connection to friends and family, where greeting each other with a kiss on both cheeks is standard practice, that would be a huge deterrent to admitting you had or were potentially exposed to COVID-19. Some of that fear and stigma is also rooted in historical discrimination from the HIV/AIDS epidemic. This is compounded by language barriers and cultural views on Western medicine versus more traditional herbal remedies. So what did the county do to reach this population? They included Haitian Creole translators at press conferences. They also established a testing center at a Catholic church who holds Mass in Haitian Creole. Miami-Dade County has indicated that 22% of the money they've spent on outreach related to COVID-19 has been on radio, billboards, newspapers, and ads targeting the Haitian community. Many of the ads they plan to run in the future will feature medical professionals of color to deliver their message. At the end of 2020, the city also purchased airtime for a COVID-19 campaign to run for 30 days on a cable news station, Island TV, who provides news in Haitian Creole. One of the people who's discussed as a key driver in many of these strategies was a local Haitian American county commissioner who played an enormous role in raising awareness about the challenges and stigma within his community to then help suggest actions the city might take to effectively reach the community. This small example highlights the importance of diversity throughout government and across organizations. When we talk about the decisions that we make as emergency management or mitigation professionals, one of the things we need to talk about are the people at the table. If you do not have a diverse group of people helping make decisions about who you're communicating to, how, and through which channels, you will inevitably miss a group or fail to understand or effectively communicate with them. Even if your staff lacks this diversity, you can bring community members and leaders to the table to ensure they help you make important decisions and inform your strategy. Miami-Dade County took steps to impact many of the factors that impact risk perception that we've discussed throughout the presentation, and there's still more to do. It's important to address the way they incorporated ethnic media into their strategy, recognizing where the community they were intending to reach got their news from. They also learned about the community they wanted to reach and developed specific strategies to reach them, including using a trusted community church to conduct testing. Over the last 25 minutes, we have talked about strategies different communities have used to impact both mitigation as well as recovery. We rooted each of these in the idea of risk perception, attempting to increase trust, awareness, and control by leveraging community partnerships, considering the channels we're using to spread our message, and thinking about how we can increase people's perception of their ability to affect the outcome. You can use all of these strategies to impact equitable delivery of risk communications. And as we said earlier, you can actually decrease vulnerability through effective communications. We're so excited to hear how you incorporate these strategies into future communication. Please reach out to us and share any questions or any feedback you have. Thank you so much for joining us here today, and we look forward to hearing from you soon.